Very good morning, one and all. Today, we are here to start our class on supportive periodontal therapy. So, let me just share the screen. Yes. So, today's class is on supportive periodontal therapy. So, you can see the three synonyms of this phase, that is maintenance phase, recall or re-evaluation phase, and supervised or recall program. It is also called as phase 4 therapy. So, coming on to the definition, procedures performed at selected intervals to assist the periodontal patient in maintaining oral health is called as SPT. This is the GPT definition, and therapeutic measures to support the patient's own efforts to control and to avoid reinfection is supportive periodontal therapy as per Linde's definition. So coming on to the sequencing of your treatment, as you all know, any period treatment is having 4 phases. Your treatment plan has 4 phases: phase 1, phase 2, phase 3, and phase 4. But the sequencing of the phase will be phase 1, the evaluation, and again the patient will be placed under phase 4. During the maintenance recall visit, while you are examining the patient, when it is necessary, you will perform the phase 2 therapy. Again, the patient will be placed in the phase 4 maintenance phase. Then, when it is needed, you will perform even the phase 3 or the restorative therapy. Then the patient will be placed in the phase 4 of maintenance, wherein phase 4 or the maintenance phase plays a very vital role in the success of all your periodontal treatments. So coming on to the rationale for SPT, we have 5 rationales. That is limitation of your mechanical subgingival debridement, recolonization of the periodontal pocket, healing by long junction epithelium, and subgingival scaling alters the microflora of periodontal pockets and to prevent interception. So these are all the 5 rationales of SPT. Coming on to the goals, you have 3 main goals. First is to prevent or minimize the recurrence and progression of periodontal disease in patients who have been previously treated for gingivitis, periodontitis, and for peri-implantitis. The second goal is to prevent or reduce the incidence of tooth loss by monitoring the dentition. And the third goal is to locate and treat other diseases or conditions found in the oral cavity in a timely manner. So these 3 are the goals. We have seen 5 rationales and 3 goals of SPT. Coming on to the objectives. In objectives, we have 2 different objectives. That is a periodontal objective and a general objective. As you can see, the periodontal objectives are preservation of bone support, maintenance of stable clinical attachment level, reinforcement of proper home care, and maintenance of a healthy and functional oral environment. Coming on to the general objectives of SPT, assessment of the general health status, encouragement of patients on oral hygiene efforts, continuation of patient education, and establishment of future maintenance. You have 2 types of objectives: periodontal objectives, general objectives, and in each objective you have 4 points. Okay. So coming on to the types of SPT, we have 4 types of SPT according to Shallon and Snyder. The 4 types are preventive maintenance therapy, trial maintenance therapy, compromised maintenance therapy, post-maintenance treatment therapy. First, preventive maintenance therapy. Preventive maintenance therapy, as the name suggests, it is given for patients who are periodontally healthy. Trial maintenance therapy is given for mild to moderate periodontitis patients. Compromised maintenance therapy is given for medically compromised patients where active therapy is not possible. And coming on to the post-maintenance therapy, it is given for patients who have already underwent periodontal treatment and they are placed under the maintenance for prevention of recurrence of the periodontal disease. Now coming on. Wait a minute. It's coming on to the maintenance program scheduling. According to Carranza, the maintenance program scheduling is done for 60 minutes. First 14 minutes, it will be there for examination and evaluation. Then 36 minutes is allocated for maintenance treatment, oral hygiene reinforcement, and 10 minutes is allocated for report, cleanup, and scheduling. Coming on to the part 1, that is the first 14 minutes. What you're going to do, you will just treat the patient. You will just evaluate all the periodontal and the gingival conditions and entire medical history, oral hygiene, gingival, periodontal pocket depth changes, mobility changes, occlusal changes, all the changes, all the exact condition of the exact status of the patient will be examined and evaluated. This will be for first 14 minutes. Then for the next 36 minutes, that is part 2, it will be oral hygiene reinforcement, scaling, polishing, and chemical irrigation if needed will be provided in the phase 2, or that is part 2 of the reappointment, that is a rescheduling appointment. Coming on to the part 3, that is the last 10 minutes of your recall schedule will be writing the report, discussing the report with the patient, scheduling the next recall visit, and then just scheduling all your periodontal treatments and the restorative and prosthetic treatment for the patients. So this will be performed for the 16-minute scheduling of the recall visit. Coming on to the frequency, according to Ramford, for most patients with gingivitis, where there is no previous attachment loss, SPT can be provided once in every 6 months or twice a year. For patients with previous history of periodontitis, 3-month interval or less than 6-month interval is given, and various clinical trials suggest that whenever there is any periodontitis patient, it is always advisable to give SPT appointment 4 times a year. Coming on to the most important question in SPT, Merritt's classification. This is the classification of post-treatment patients, wherein any patient who is undergoing periodontal treatment will be placed in first-year patient. After that first-year patient, you will be classifying the patients as Class A, Class B, and Class C. First-year patient is, whenever the patient is having, you just see here, there are 2 first-year patients which is given here. First, whenever there is any routine therapy is given and uneventful healing is happening, the patient can be recalled once in every 3 months. But any difficult case with complicated processes, percussion involvement, poor count-root ratio, or questionable patient cooperation, these first-year patients will be called once in every 1 or 2 months. Can you understand the difference here? Then, after the first-year patient, you can classify the patient as Class A, Class B, Class C. Class A patients are those first-year patients who had excellent results, well maintained for 1 year or more, and the patients who display good oral hygiene, minimal calculus, no occlusal problems, all these, much of no compromises there, no? All these cases can be called for recall visit for 6 months to 1 year. When coming on to the Class B and Class C patients, Class B patients are mostly those who had good prognosis, that they had good results actually, but they are having some factors associated with it, like inconsistent or poor oral hygiene, heavy calculus formation, systemic disease, remaining residual pockets, occlusal problems, etc., and some teeth which have less than 50% of occlusal bone loss. These patients can be recalled once in every 3 to 4 months based on the presence of the negative factors. And coming on to the Class C patients, Class C are generally poor results after periodontal therapy, and there are presence of more negative factors like inconsistent or poor oral hygiene, heavy calculus formation, systemic disease, occlusal problems, complicated processes, recurrent dental caries, and there are many teeth with less than 50% of alveolar bone support. So for these Class C patients, recall visits are always scheduled from 1 to 3 months based on the number and severity of the negative factors present. So this completes a gist of your SPT. Thank you. So with this, I'll just complete the class. Thank you for your attention.